Hello Professor, my name is Sheetal and my student ID is 1199762449. Today I am here to demonstrate the head-to-toe examination video, and here is the 360 view of the room. Okay, hand hygiene is done, privacy is maintained. So hello Divya, I am Sheetal, I am your student nurse for today, and I will be doing your head-to-toe assessment video as per the doctor prescription. Are you ready?
Yes, I'm ready.
Okay, so before starting, can you please tell me your name,
Divya Sachdeva.
your date of birth?
14 June
Can you show
2001.
me your ID bag as to cross check? Okay, thanks. That's great. Now I'm going to start with the neurological assessment. For this, to check your level of consciousness. So Divya, where we are?
At home,
What time it is?
12 o'clock.
Who I am?
My student nurse.
Okay. As I can see, the patient is fully oriented to the time, place, and person. I will be checking for the perla. Okay, for this I will dim the light, and the way you have to focus any distant object. Okay, on the perla I will be flashing light on your right eye and check the response for the pupil. Same with the another eye. Okay, now I'm going to check for the consensual response. For this I will be flashlight on your right eye and checking the response for the left one. Vice versa. Okay. Divya, you have to focus on the tip of the pen as I move it closer to you or away from. Do not blink and do not move your eye. Next. Okay, that's good. As I can see, the perla is normal. The pupils are round, equal, and reactive to the light, and also bilaterally accommodated. Now I am going to check for the facial drift, slur speech, and pronation drift. Okay, for the facial drift, Divya, can you please smile? Raise your eyebrow, close your eyes. For the slur speech, you have to repeat the words after me. Moonlight, tic tac, chit chat.
Moonlight, tic tac, chip chat.
Okay. And for the pronation drift, you have to stand on your place. Just raise your hand on the palm side, close your eyes, and count 1 to 5.
1, 2, 3, 4, 5.
Okay, that's great. Sit down. As I can see, there is no signs of any facial droop, slur speech, and pronation drift is also negative. Okay, now I will proceed with the respiratory system. For this, I will inspect the chest anteriorly and posteriorly. As I can see, the patient is breathing normally, so the breathing pattern is normal and regular. There is no signs of any nasal flarings and labor breathing. So I will be check the landmarks, that is 10 anterior and 12 posterior, but I will be checking only 6 anterior and 8 posteriorly, and I will be start with the apex of the lung. So Divya, you have to do deep breath during the whole process. Okay, Divya, can you please move back? Okay. Okay. Now I'm going to check for the symmetry. For this, I will place my both hands on the lower aspect of the lungs to check the chest expansion and retraction. Divya, deep breathe. Okay. Now I'm going to check for the tactile firmness. Divya, say 99.
99, 99.
Okay. As I can see, during the auscultation, there is no adventitious sound such as whizzing or crackles, and the lungs are also clear bilaterally. On the tactile firmness, I heard the vibrations all over the lungs. There is no increase and decrease at any point. Now I'm going to check the cardiovascular system. For this, I'm going to check the 4 cardiac walls of the heart. The first one is the aortic wall. Here is the clavicle, the first intercostal space, the second. Okay, the aortic wall is placed on the second intercostal space on the right sternum border. The parallel to it is a pulmonic wall, which is situated on the second intercostal space on the left sternum border. The Erb's point is on the third intercostal space on the left sternal border. The tricuspid bone is on the fourth and fifth intercostal space on the left sternal border. And the last one is the mitral bone, which is situated on the fifth intercostal space at the mid-clavicular line. Also here I can hear the apical pulse, and I'm going to listen the apical pulse for 30 seconds. Okay. The rates come out to be 36. I'm going to multiply it by 2, which comes out to be 72. So the rate is 72, the rhythm is regular, the strength is 2 positive. On the auscultation, I heard only S1 and S2, which is left up sound. There is no any murmur S3 and S4 sound. So now I'm going to check for the abdominal assessment. Divya, can you please lie down for me? Okay. Now I'm going to see the and inspect the abdominal. Okay. The abdominal is symmetrical, flat, and there is no abdominal distension. Now I'm going to auscultate the bowel sounds. For this, I will auscultation start on the 4 quadrants, and I will be starting the right lower. Going in the clockwise fashion. I can hear all the bowel sounds on all the 4 quadrants, and also it's no active. I'm going to palpate. Divya, please let me know if you feel any pain. Deep palpation. Okay. On the palpation, there is no pain, lesion, scar, mass, rigidity, and annulum formation. So I'm going to check the integumentary system. For this, I'm inspecting the skin first. There is no scar, lesion, pallor, and cyanosis of skin. Okay. Now I'm going to check the temperature bilaterally. On the left. Okay. The body is warm to touch. There is no cold temperature. Now I'm going to check for the capillary refill time. Divya, can you please hold your hand? The nail buds are pink, smooth, and I'm going to pinch it. Okay, the capillary refill time is less than 2 seconds, which is normal. Now I'm going to check for the turgor. For this, I'm going to pinch your arm. Okay, I'm going to pinch your arm bilaterally. As I can see, the skin is moving back immediately, so the turgor is normal. Now I'm going to check for the pressure points on both elbow. Okay, both legs. Okay. There is no sense of any redness wound, and the skin is intact. Okay. Now I'm going to check for the musculoskeletal assessment. For this, I will check the extension and flexion. Divya, please move your arms towards your body, away from your body, again towards. Okay. Now I'm going to pull it, and you have to resist me. Then raise your leg. Okay. Same with the legs. Okay. As I can see, the extension and flexion is normal, and the strength is +5. Now I'm going to check for the pulse. The first one is the carotid pulse. Okay, which is next to the trachea and anterior along with the sternocleidomastoid muscle. I'm going to check for the another side for the equality. Okay, the rate is normal, rhythm is regular, and the strength is 2 positive. Now I'm going to check for the posterior pulse. Okay, which is distal to the medius malleolus point. Now I'm going to check for the dorsal pedis, which is on the highest point of the metatarsal bone. Just lateral to it is R. Dorsal pad is bone. Okay, as I can see, the both pulse are regular and rate is also normal and strength is 2 positive. So here I am done with the head to toe assessment video, and here is the 360 view of the room. Thank you, Professor.